this journey, and we have many examples of where we've shifted the journey, but it is still true to say, and we are all users, aren't we, and well, patients, clients, whatever we want to say, of these services, it still feels like a mess of spaghetti, a complex, confused system in which we are bit part players. We're moving on it, but it's fair to say our system is still messy, complex, fragmented, there's duplication, we don't understand what each other do well enough, and we sometimes argue about who is going to pay for what we do and where it's going to happen, what they do. And it's a journey we've begun, and it's not a journey we've completed, and it's certainly not a journey that in all instances has you, me, our families and the communities at the heart of what we're doing. And clearly what we are trying to do is shift that together, and that's what we have the capability to do, the people in this room.
I think the key bit of information I got was the sort of different type of examples of good work happening across the district. So, for example, the two workshops that I attended in the morning, especially around the heart and diabetes, it was the level of innovation in Bradford, and we don't really celebrate that at times. And some of the real good practice that is taking place. There were some real good examples of how we've managed data sharing within the health sector, and how do we use that methodology and scale it up across the district. For me, some of those examples, practical examples, engaging with communities at an early stage, some of that stuff around early intervention and prevention, I think there's some real good examples of how we're making real live examples and case studies, and that needs to be celebrated and actually applied elsewhere as well.
Today was an eye-opener. As a newly qualified social worker with the Bradford Council, I found it very educational and informative. I have learned things about new resources that are available out there, how to signpost my service users that I work with, and it has been great. Thank you.
Well, I think mainly working in partnership with colleagues in health and the third sector, and trying to make a difference to the citizens of Bradford and Craven. I think that's the most important part of the work, really, that we're engaging and making a difference. And I suppose from a self-care and prevention programme point of view, having a collaborative approach, engaging with different communities, and finding out what's important, where the barriers are, and how we can shape services for the future to support people across the district.
I had a great day today at the learning event. There were some really great speakers today. Some of the things I learned was the other people kind of involved the same issues that I'm dealing with. For example, dealing with people with multi-complex systems and processes around their care.